Good afternoon. My name is Hallie Morris, and today I'll be discussing Rock-A-Back Baby. Rock-A-Back Baby is a DNP-led primate prevention program aimed at SIDS prevention and safe sleep promotion. Please take a minute to review the table of contents that will be discussed within this presentation. So what is SIDS? SIDS, also known as sudden infant death syndrome, can be defined as the sudden and unexplained death of an infant under 12 months of age that remains unexplained after a review of the clinical history, complete autopsy, and death scene investigation of an infant. So we know those under 12 months of age are at risk for SIDS, but what exactly puts them at risk for SIDS? Although SIDS can be defined by an unexplained origin, there are several risk factors that have been associated with the incidence of SIDS. Despite the success of several preventative campaigns initiated in the 90s, targeting modifiable risk factors related to SIDS, SIDS still remains the leading cause of infant mortality in high-income countries. Babies put to sleep on their stomach and sides are at an increased risk for SIDS, especially those babies who are used to sleeping on their backs. When they're put on their bellies for tummy time, they have no control of their necks that could lead to suffocation or a SIDS type event. Babies also born before 37 weeks are at a higher incidence for SIDS. This is because of their low birth weight below 5 pounds 8 ounces. Parent and caregiver consumption of nicotine and alcohol during pregnancy and postpartum can also place the baby at increased risk for SIDS. Of course, babies who co-sleep are automatically put at an increased risk for SIDS and suffocation. So what exactly is safe sleep? Infant sleeping care practices are recognized as the most critical factors parents and healthcare practitioners can use to influence to reduce the risk of sleep-related infant mortality. In this slide, you can review safe sleep practice guidelines. Although adults may prefer soft surfaces for sleep, research shows that babies who are put on top of soft surfaces for sleep or with items in the bed with them are at a high risk for SIDS and other sleep-related deaths. Bed sharing may increase the risk of overheating, rebreathing, or airway obstruction. All of these are risk factors for SIDS. An easy way to remember some safe sleep guidelines are the ABCs of safe sleep. Babies sleep safest and best when they sleep alone, on their backs, and in a bare crib. In this graphic, you can view a baby participating in some safe sleep guidelines. A brief resolved unexplained event, also known as a BRUI. So what exactly is a BRUI? Well, in 2016, the American Academy of Pediatrics published a clinical guideline. This guideline recommended replacing the term near SIDS event with the term a brief resolved unexplained event. Infants at high risk for BRUI events are those younger than 2 months of age, those with a history of prematurity, and those with a history of another BRUI episode. Infants who have had one or more BRUI episodes appear to be at increased risk for SIDS. So what exactly happens in these BRUI type episodes? Well, baby will experience some sort of color change. They will either get really pale or even turn blue. Baby can also experience some cyanosis in the lips and around the eyes. Baby will have abnormal breathing or even apnea and absent breathing. You will also notice a change in tone in baby, whether it be hypertonia or hypertonia. Baby will also experience some decreased level of responsiveness or altered mental status. Some statistics about infant mortality. Research suggests there are an estimated 3,500 sudden unexplained infant deaths in the United States each year, a combination of SIDS and unsafe sleep practices attributed to 66% of them. Despite continued efforts to promote safe sleep, SIDS mortality rates in the United States continue to rise. Some more statistics about infant mortality. Despite current safe sleep campaigns such as the Back to Sleep campaign initiated in the 90s, unsafe sleep practices remain a pressing issue in the United States. The following graphic demonstrates a trend in different types of unsafe sleep practices and how they've affected infant mortality. These include bed sharing, the use of soft bedding, and even the incorrect positioning of the baby, whether it be on their bellies or sides. Infant mortality reflects a tragic moment in a family's life. and in some instances, the failings of both social and healthcare institutions of a community. It is our job as providers in the community to provide the proper education and resources to prevent infant mortality. Babies are born entirely dependent on another human. They lack autonomy and decision-making capacity to care for themselves. There is no evidence that genetic influences outside of social and environmental factors lead to the sudden death of an infant, making babies automatically vulnerable. Caregivers as a vulnerable population. Though babies are a vulnerable population within themselves, this community project is aimed at educating parents and caregivers. Babies from parents and caregivers in low-income areas have 3 times the rate of SIDS compared to those in higher income groups. Research describes that sudden infant mortality rates were almost 4% higher among infants born to women under the age of 20. Research also suggests that SIDS events are more likely to decrease with increasing birth order, meaning as a female, the older you get and the more babies you have, the less likely your baby is to have a SIDS event. There is no evidence of genetic influences outside of social and environmental factors that pose a risk for SIDS. Infant sleep and care practices to reduce the risk of sleep-related infant mortality are essential for parents and caregivers to comprehend when it comes to keeping babies safe. Parents and caregivers play a crucial role in decreasing SIDS. By placing babies on their backs to sleep for all sleep times, creating a safe sleep environment for the babies, and following evidence-based recommendations, everyone who cares for the baby can help reduce the baby's risk for SIDS. It is essential that all caregivers, from parents, grandparents, aunts, uncles, babysitters, and even siblings, learn about safe sleep and how to reduce the risk of SIDS and other sleep-related infant deaths. So how can we help? Well, to help, we initiated a program called the Rock-A-Back Baby Program. The name Rock-A-Back Baby is essential in 2 different ways. Not only did it come from a nursery rhyme, Rock-A-Bye Baby, and is easy for parents to remember, but when you say Rock-A-Back Baby, you can learn an easy reminder for safe sleep practices, the firm service with the baby on your back, and just the baby. The name gives an easy way to remember safe sleep practices, but our purpose for this program is far more than that. Primary prevention can be defined as a prevention measure aimed at a particular population or individual. The purpose of primary prevention strategies is to prevent a disease or health outcome from occurring. Education plays a significant role in primary prevention. This community program is a primary prevention program aimed at educating parents and caregivers to decrease SIDS and promote safe sleep within the community. Rock-A-Back Baby is designed to be a hospital-based program initiated before the baby is discharged home, providing education from safe sleep, schedule implementation, breastfeeding, and proper use of bottles will help the baby to be properly taken care of before discharge home. So how will Rock-A-Back Baby work? Multiple team members will round on the baby and parents before discharge. The team will collaborate to determine the needs of both baby and family. Information and education will be given prior to discharge. If the family does not require any help or services, they can still get our services through the local health department after discharge. So who makes up our amazing team? Our amazing team is made up of the D&P nurse leader, registered nurses, lactation consultant, nutritionist, speech-language pathologist, social workers, and even all of those who work at the county health department. Each member of our team has a significant purpose into this program. The D&P nurse leader will conduct the initial interview with the parent or caregiver of the baby. The D&P nurse leader will provide verbal and written education on safe sleep practices and other important information needed before discharge. From there, the bedside registered nurse will take over helping parents learn primary infant care. This will include suctioning with a bulb syringe, correct ways to swaddle, and even how to perform infant CPR if needed. A lactation consultant will be available to help mom and baby breastfeed to the best of their ability. Breastfed babies are less likely to have a SIDS event. However, if mom decides she does not want to breastfeed, a nutritionist will then see mom and baby to determine what proper formula to put them on. A speech-language pathologist will also visit baby to ensure proper feeding techniques, whether using bottle or breast is being used. Bruit events are likely to occur with reflux and other feeding difficulties, so this is very important. A social worker will visit each family before discharge to determine needed resources. For example, if baby does not have a safe place to sleep at home, a crib or bassinet will be given to them prior to discharge. This will help promote the ABCs of safe infant sleep. Community health departments play a significant role in the Rock-A-Back Baby program. Information will be provided prior to discharge on obtaining these resources within the community. There will be 2 ways that we can measure this program's success. The first one is that we can trend the rates of SIDS-related infant mortality and Bruit events after we initiate the program. If rates have decreased, then we know that education and resources that we are providing parents and caregivers prior to their hospital discharge is actually working. The second thing we can do is record a ratio of how many babies were initially seen versus how many required our resources. This will also help us to determine where we need to put our resources and funding towards. For example, suppose we see 10 families and 8 families have required cribs or bassinets from the social worker. In that case, we know that we need to put our resources and funds towards obtaining more cribs and bassinets to provide families. This slide shows examples of handouts that can be given to caregivers in coordination with verbal education before discharge. These include some safe sleep practice guidelines, breastfeeding education, and even a cheat sheet on feeding and sleep schedules for parents to use. The role of the DNP in the Rock-A-Back Baby program includes planning and coordinating the program, building a successful team of individuals capable of promoting success, and ensuring that caregivers are given their proper education and resources they need prior to discharge. Some competencies of the DNP nurse leader include decision-making, project management, strategy, and ethics. Decision-making and strategy are essential in developing the project itself. The DNP leader must strategically plan each phase and implementation of the project in order to promote project success. The DNP nurse leader also does project management. The DNP nurse leader must be able to step into this leader position and help manage the primary prevention project and other disciplines within the team. The DNP leader must follow ethical guidelines when implementing projects within the community. Leadership competencies such as strategy, ethics, decision-making, and project management are essential in making the Rock-A-Back Baby program successful. More leadership competencies necessary for the advanced practice nurse in developing and implementing Rock-A-Back Baby include communication, motivation, coaching, and collaboration. The DNP nurse leader must be efficient with communication. This is essential in communicating with other team members as well as caregivers. The DNP leader must be highly motivated. With motivation comes high success in the project. The nurse leader must collaborate with other disciplinaries and caregivers participating in baby's care. This is essential to the success of the infant. The DNP leader may also show appropriate coaching techniques. These include teaching and leading others while being a supportive team player. These competencies will play a significant role in the success of this community program. SIDS is a sudden unexplained death of an infant. Though it is defined as unexplained death, many risk factors place infants at high risk for SIDS event. By following safe sleep practices and guidelines, the estimated almost 4,000 infants that die each year related to SIDS can decrease dramatically within our community. Rock-A-Back Baby is a primary prevention project established to promote safe sleep and decrease the incidence of sudden infant death in our community. The program consists of resources and education provided by multiple interdisciplinary team members to help families and babies in the community. Though the program will originally be initiated in the hospital setting, parents can gain resources they need through the community health departments. A decrease in the sudden death of an infant, along with a decrease in Bruit type events, would pose a positive correlation in the program.